Alright, so we want to actually talk about another classification of what arthritis. Arthritis is like inflammation of the joint. So this one we say it is crystal-induced. So when you see something is crystal-induced, it's literal. There's deposition of crystals there. So because there's deposition of crystals there, that's what made that place to become inflamed. So crystal-induced osteoarthritis is as follows. So it's not one disease condition, plenty disease conditions, right? So you have what? It's a group of joint disorders caused by what? Deposition of microscopic crystals in the joint space. These are the crystals. They are literally looking like glasses when you look up with them and magnify them. So these crystals, they trigger inflammation, leading to what? Sudden pain, swellings, and stiffness. The two major types are gout and pseudogout. Okay, gout is caused by Monosodium urate crystals. Pseudogout is caused by calcium pyrophosphate deposits. Okay, calcium pyrophosphate dihydrate crystals. While we have what? The basic calcium phosphate disease caused by the hydroxyapatite crystals. Okay. Rare forms, we have what? The oxalate and the cystine crystals disease. Usually happens in metabolic disorders. So risk factors is usually when uric acid levels are high, the person is obese, takes a lot of alcohol, takes a lot of food that contain a lot of purines, and kidney disease. So for pseudogout, if the person is old, joint traumas, surgeries. Okay. So diagnosis, joint aspiration, where you get to what? Look at it on microscopy and you see that what? There is polarization. That's like there's crystals. Okay, look at it under the polarized light microscope. So goat crystals are usually needle shape. Pseudogout crystals are usually what? Rhomboid shape. Blood tests, you see that uric acid levels are high, inflammatory markers are also high. X-rays will show what? Chondrocalcinosis. So treatment, use all those non-steroidal anti-inflammatory drugs, colchicine, then corticosteroids, then uric acid lowering drugs such as what? Allopurinol and the febuxostat. So pseudogout, no crystal lowering therapy exists, but you just try to manage all those inflammation and pain. So that's what we got for this too.